to take that into consideration in the decisions, the great decisions that we'll have to make over the next few days. Now, let's go to the good news aspect of it. Good news to be able to work on the variants. Somebody was telling me that vaccination is a little bit like our massive decrease weapon. And vaccination allows us to decrease our level of risk, but we still have a lot of work to do in order to be able to control contagion. That is why, in the places where the variants are more present, as I was mentioning a few minutes ago in the Montreal area, that is why we are identifying and we are intensifying our vaccination process. So when people ask us, why are we doing more in Montreal than elsewhere? Well, that is the reason. And we've decided, thanks to very good collaboration with pharmacists, to accelerate their contribution in the vaccination process. In fact, pharmacists, we wanted to work with them as of the beginning of April, but we are accelerating that period, and we're going to start with that 2 weeks ahead of time. So people will be able to get vaccinated at the pharmacy. What we're announcing to you today is that not only the first schedules for appointments will be available in pharmacies as of the 15th of March, but this morning we finalized, together with the Association of Pharmacists, that there are 350 pharmacies that would be available on Montreal Island to be able to make appointments as of the 15th of March, and that is very good news. The places in detail will be revealed over the next few days. In the following weeks, of course, the principle of working together with pharmacists is going to be extended in other regions in Quebec. Now, I want to explain to people quite well, and first, I understand that there was a rumor going around that we're going to be working with pharmacists. People have already started calling pharmacies. The owners were telling me this morning, please, could you wait until the 15th of March? So the offer of the pharmacist is complementary to our own offering. It'll be the same age groups, the same priority categories. So I would ask you, please, to wait. I mean, you can call your pharmacist. I'm not telling you not to call your pharmacist, but don't call them to get an appointment. Please wait for the 15th of March. And we'll get back to you in the following press conferences with the right way of functioning with pharmacists. I think it is important to underscore that this is a first in the history of vaccination in Quebec. We had the great chance to work with them during the influenza period last fall, thanks to what was put up by my predecessor, Ms. McCann, who had that vision last year of preparing the bill that allowed us to work together with them in the fall of last year. And for us to be able to have that agreement with the pharmacists, there's over 1,400 pharmacist owners who are going to come and help us out with this vaccination process, the mass vaccination process. And I wanted to underscore how excessively significant an element it is in our strategy that we are accelerating, particularly to give us a hand in the Montreal region. Another point on vaccination, from a regional point of view, I think that people now understand that it may be normal, maybe not always acceptable, but it may be normal, but that we're not at the same ages in the same places. Each region has its own epidemiological situation, and with the number of vaccines that they receive, but also, and I'm thinking here about my own area, which is the Montérégie, well, in the Montérégie region, they are not yet at 70 years of age like they are in Montreal, because the epidemiological situation is different, because they got some vaccines because we decided to concentrate them in the epicenter, but they haven't yet finished vaccinating their RPAs. So it's important to understand that the Montérégie is also going to go to the 70-year age bracket, because I was hearing all sorts of comments this morning but we have to understand that the situation is different depending on the region. And we know that in the Montérégie region, I mean, I know it, there are more RPAs, so we have to finish those priorities before going to other categories. Now, as far as other regions are concerned, they will also intensify the vaccination process because, and Mr. Paris will be able to talk to us about it, we will have significant deliveries that are being planned in the following weeks. And maybe just a reminder on our first great mass vaccination day, Mr. Paré. I think that, yes, we had a few problems, we had a few issues, and I think that it's normal in the first day to have to tweak things and adjust things. There's always a few glitches, but I think that it's a good point to remind everybody of the excellent work of our teams. First, to prepare themselves for this mass vaccination. And I mean, I've seen people who waited a little bit yesterday, and now we can talk about all the corrections that we're bringing to those glitches, particularly in the greater centres. But I think that there are adjustments to be brought on the field that Daniela will perhaps be able to explain as needed. So, one thing that I would like to say for those who are making appointments, because I was told earlier on that things are going better already in our greater centres, particularly for those people, the elderly, don't arrive too much ahead of your appointment. I know you don't want to miss it, but you don't have to worry. Your vaccine is reserved for you. And rather than waiting for an hour and a half, just arrive 5 or 10 minutes before, and your vaccine will be kept for you. You don't need to worry about that. However, I want to reiterate, these are appointment centers. Do not go there if you do not have an appointment. You make other people wait for nothing, and we really have to have that discipline of going through the internet or through a phone appointment, but have an appointment before you go. We would also ask, because we've seen many of those cases yesterday, there were many people bringing there were many people who were trying to have, a vaccine, and there were many people bringing an elderly, but it's one person who has to accompany an elderly only, not more than one person. The last point that I would like to bring is that, as planned, we will give the appointment for the second dose on the premises, and I would ask you to be a little flexible, because I was seeing people yesterday saying, well, I can't on that day, I would prefer the other day. Well, I can tell you, with 7 million appointments to be placed twice, I would ask you to just accept the appointment that is given to you, please, because it's a lot of logistics to have to deal with for my colleague here. I would also like to make a small comment on the vaccination passport. I had never realized that it would be such a debate. The answer that I gave to your colleague last week, there are many things that were said, but I think it is important to remind ourselves of the objective of the vaccination proof. What I said, and I'm going to reiterate it for it to be very clear, is that it's only an operation, a digital operation of the vaccination registry that already exists. It's not going to be like certain people wanted to insinuate an intrusion in people's lives. This is nothing new. I explained it in the press conference, and perhaps I wasn't clear enough, but we have already given vaccination proof to people when they wanted to take the plane. All we are doing is making it digital. So I just wanted to clear that up. That's all it is. And we're going to be working, as my colleague does, to make the government more digital, more modern, and we wish to do it with a vaccination in the same way. Now, I would like to end with the measures after the 8th of March. Now, I'm sure that there's going to be a lot of questions today to know what we are going to be announcing tomorrow, but we are not going to be answering that. We'll answer tomorrow. And if you insist, I'm going to tell you, I told you, we'll answer tomorrow. We wanted to take a little bit more time, as we had done a few weeks ago, because I think that it is important to, bring everything together, to connect the dots, and the situation is evolving very quickly. So that is why we decided to take an extra day. We'll give you all the details tomorrow. A few words in English.
I think the epidemiologic situation in Quebec is interesting. We have the curve of the old stump, and I'll use the Dr. Arruda, the way it's going down, the old stump. But below, the curve of the British variant is rising, and is rising quite a bit. And in the greater Montreal area, the British variant is rising rapidly. We are afraid, and we are afraid that the Montreal region is the calm before the storm. And I think it's important that you take that into account for the announcement that we will make tomorrow. On vaccination is our weapon of massive risk reduction. And I think that this is exactly why we put those variants, and the way we deal with them is with vaccination. And this is the way that we put a lot of priority in Montreal area right now. Now, with regard to the pharmacists, I think we're very, very pleased to announce that we will work with them in the Montreal area. People will be able to be vaccinated in pharmacies. Appointments can be taken, not before, but can be taken starting March 15, and pharmacists will be complementary to whatever Danielle Works is doing. So with regards to the ages and the region, this will be complementary to our work. One quick comment also, we've received some comments that why is it different that we take, for example, in Montérégie, people that are 85 years old, and in Montreal Island, we go at 70. Well, regions are different, and they're different for many reasons, and we will adjust very quickly. Hopefully, we can come down on Montérégie as quickly as possible. All regions will intensify vaccination, and depending on deliveries that we get, I think we'll be able to even accelerate more, but we'll keep those news when they come in. I want to come back also on the first day of mass vaccination that we had. I want to emphasize the good work that was done by our team. I think that was quite an accomplishment. We had, I think, something like 17,000 people that got vaccinated yesterday for our first big day. I think that's good news. And of course, I think it's normal that we have few adjustments to make. I want to remind people not to come too early, because if you come an hour early, you need to be in lineup. And I suggest 5-10 minutes is sufficient, especially for elderly people. Let's make sure that you come on time, but don't wait too long. And please make sure that the people that accompany you are limited to one person. People have tried yesterday to come 3 or 4 with one person, with an elderly, and try to be vaccinated. It doesn't work. We need to respect the principle of those appointments being taken in advance. I think that complete my presentation, and I would like to go with my colleagues to answer some questions.
Oui, alors nous allons maintenant passer à la période.
We are going to start the question period.
Nous allons débuter en français. Comme nous avons un modèle hybride, il y aura certaines questions qui vont être sur place et d'autres via Zoom par la suite. Donc, première question, François Carabin, Journal Métro.
Bonjour, messieurs.
Hello, gentlemen. Mr. Dubé, you alluded to a few glitches yesterday in the mass vaccination strategy. You saw, as I did, the waiting times for certain people who wish to get vaccinated. It looks like the waiting lines that we had in our screening tests this summer. So what adjustments are you going to be bringing over the next few weeks if we take into account that there will be a lot more people that are going to want to get vaccinated once we go to the 70 years and over? If I could give the mic over to Mr. Paré and perhaps complete if necessary. Yes, what we have to understand is that it's one of the most difficult groups right now that we had to vaccinate, people who are elderly, who have some of the mobility challenges. So what we saw yesterday was, as Mr. Dubé was mentioning, a lot of people who showed up ahead of time. I think it's part of our habits to show up to our appointments ahead of time, but we chose here in Quebec to proceed to the mass vaccination by group to avoid that. That's why we have to explain that correctly. That's the first thing. We have to explain well how things work. Of course, we saw it on one of our sites, like the Olympic Stadium. We added wheelchairs at the SUS. They were pretty proactive with these elements as well in order to make sure that we have places where our elderly can rest. Also, as far as the appointments are concerned, as we were speaking before, we want to make sure that we are able to give appointments more quickly. the more people go on our internet site to register, there's a lot of information in that. It also allows it to go more quickly. That's why when we talk about groups, the following priority groups that have probably used the website more information will be entered and will save time here as well when people register on the site.
Merci. Monsieur Dubé, vous avez rien à ajouter?
Mr. Dubé, you have nothing to add? No. To continue, I had asked you the question last week, Mr. Dubé, on vaccination at home. You had said you were open to study certain mechanisms that are used in other countries. Is it excluded for the time being, vaccination from home, or is that still being evaluated? Well, yes, we have been thinking about it, and I really appreciate being able to answer the question today. In fact, I would divide that up in 3 and perhaps with the pharmacists in 4 different categories. Of course, for those people who are elderly, and I say it generally speaking, we had a very important vaccination approach with RPAs and CHSLDs. That was the first thing to be done. We have to remember that the vast majority of our elderly are autonomous and can move around. That's my second point. Even when we we finished the RPAs and CHSLDs, people can come and we see it. Yesterday, people 85 and over, you saw people who were in the different centers. So the vast majority of those people can move around. There are 2 things that we're adding right now. We communicated once again, as I said that we would do. So we communicated once again with all of our establishments, so the CIS and the CIUS, and we told them, please give us a list of people who either what we call the ISO-SMART, the level of dependency that they can have to see whether there's any that we can help with transportation. And that we're going to be working with community organizations. But on top of that, those who really cannot move around, we are quantifying it, and I would say that we're going to go regionally. So in Montreal, to be able to identify how many people we would have to go on those premises to vaccinate them. So at home, we are defining that. But what we asked Mr. Paré is to not change the focus of the mass vaccination and to work on those people. So I wouldn't be surprised if in the following weeks, and I'll just give you an example here, and Danielle will be able to finish. Because we are finishing up our RPAs, and the RPAs are being done with mobile units. We go to the premises. Those same mobile units, once we're done with them, we could use them to go to those places where we vaccinate people at home. So to summarize, I wish to reassure people who will not be able to move around. The contacts that we call SAPA in each of the establishments or contacts, they're called SAPAs. They are finalizing those lists of people who are either going to have transportation offered to them or that we are going to go to them. And my last comment is with pharmacists. The pharmacists that are going to be measuring vaccination over the next few weeks, they will also, they also know their clients. They know who might have difficulties, those places where they deliver. So all of that will be complementary over the next few weeks, and those people are going to be very well treated, and as needed, will get to their homes.
Oui, bonjour, Naïla Bendali de Radio-Canada. Une question pour vous, Monsieur le ministre, au sujet du délestage.
As far as the postponing of medical treatment is concerned, the Premier was saying yesterday that there was no urgent surgery. That was a question of life and death that was postponed, that the treatment's parameters had been respected in case of cancer. Do you have the same information? Can you state that the postponing did not cause any deaths, whereas there's already one case that was mentioned in the media whose family said that she died while she was waiting on a waiting list? The answer that the Premier gave is correct, and we all deplore the case of that young actress, and each case is its own case. I don't want to go into details, but what happened as well, and I talked about it a lot with the Premier, is that there were people who, either because they were scared of coming to the hospital or because of other cases, of course, urgent cases we never refuse, but there are cases that were perhaps not urgent 6 months ago, who, because people did not want to come, or regardless, became more urgent. So that is where it's important for us. And I'd like to take this opportunity, of your asking the question, to tell people who are listening to us, listen, we have no reason right now to not treat urgent cases. We have no reason not to do so. So if there are people who had fears and who unfortunately perhaps waited because they were scared of going, and I gave the example earlier on, last Friday or last Thursday, I went to the Maisonneuve-Rosemont Hospital, and one of the reasons why I went on the premises was to tell people, don't worry, our hospitals are safe. You can take your appointments with your specialists. So I would say that, yes, maybe there are cases that become urgent later on, but we are going to treat them. I'd like to come back to the Montérégie region, who is not vaccinating as quickly as Montreal and Laval. The CIS tells us there are fewer vaccinations in that region. Well, why not prioritize it? Whereas beside Montreal, especially with the variants, there are cases. Well, it's really, there are two reasons. The first reason, I explained it earlier on, there's the structure of the number of RPAs. You can ask Mr. Paré, he'll be able to tell you, we cannot vaccinate as quickly in a center, in an RPA, where we go with a mobile unit and that we take one person at a time, and as we do in a mass center. The Montérégie, I know that region, there are a lot more RPAs than elsewhere. Just think about, along the river, along the Champlain Bridge. So there is that issue. The second issue, we said in the first few weeks, we put more vaccinations in Montreal. We're not saying we didn't. We've been very transparent with this. That is where the fire is. That is where the epicenter is. So we said it, but we will adjust ourselves as we go along. But right now, we really have to hit hard in Montreal. We will now ask questions through the app.
Bonjour à vous trois. J'aimerais vous entendre sur le...
I'd like to hear you on the AstraZeneca vaccination. We had the confirmation that we would be receiving vaccine doses as of tomorrow. I think over 120,000 doses of the vaccine that we'll be receiving for Quebec. So what is the strategy of Quebec for the vaccination with AstraZeneca? There's a best before date. They have to be administered before the 2nd of April. And we know that the vaccine is safe, but we don't administer to people 65 and over. So how will that take place in Quebec? Well, I would divide up your question, Ms. Côté, in two. I will start with Dr. Arruda, the opinions that we will be receiving of the sick and others, and then we'll talk about the issue for delay in deliveries. Yes, perhaps just to tell you that the AstraZeneca vaccine is a good vaccination. That is why it's been authorized. As far as its usage is concerned, we are waiting for an advice from the CQ, the Immunization Committee of Quebec, who's reviewing the literature. It has been approved for people from as of 18 years of age, but certain people, especially certain groups of people, have stopped at 65, but we will be going along with the recommendations of the sick that we'll be receiving. I'm thinking that right now, in the context of the lack of vaccines, the arrival of that vaccine, which is easier to move around as well, in our opinion, is going to allow us to increase the quantity of protected people in Quebec before having a third wave, or to have an increase of variants. So we see it very positively. It's a safe vaccine. It responds to the criteria of the OMS, the World Health, the WHO, and now we're waiting for the sick to tell us in what underpopulations it could be best used in Quebec. From a more logistical point of view, in terms of delays, yes, we will receive the vaccines, but as Dr. Arruda mentioned, as soon as the Quebec Immunization Committee is going to give us the recommendations on the usage of vaccine, we are going to be adapting our strategy. We've been doing it since the beginning of the campaign. We know we adopt our strategy according to the kinds of vaccine that we receive, and as soon as the advice of the Immunization Committee of Quebec is going to be received, I assure you that it will be administered, and it will be administered before the operation date.
Dans les prochains jours, effectivement.
The question was inaudible. In the next few days. My second question, I'd like to come back to this difference in the different regions between different groups of people. It would seem that there are places where it's a lot more disturbing, like the eastern townships, where people have not been vaccinated in the operation rooms. The interpreter apologizes. The sound is pretty bad. Something about groups of people in pharmacies and who's going to be prioritized. The interpreter does apologize for that translation. The sound was not very good. The part that I would take on the pharmacists, because I was talking about it with the Association of Pharmacy Owners a few minutes ago before coming here to finalize the details. The vaccinating pharmacists are going to be vaccinated. You know, of course, there's nothing easier for vaccinators to vaccinate one another at the beginning or the end of the day, so that is not an issue, and they understand very well that we're not going to we're going to have the same approach with vaccinating pharmacists. Now, as far as the rest of the regions are concerned, I didn't understand your question. I'm sorry. You talked about the eastern townships? I'll let Danielle answer. Well, right off the bat, I think that we have to know that the priority group, which are our healthcare workers who are in contact with users that were prioritized, we've taken over 200,000 members of the staff that have been vaccinated, and that in all regions of Quebec. Now, perhaps if I could also improve, bring more elements on the different vaccinations in the regions, we have to look at things in a relative way. We're talking about 120,000 in 12 million, and we prioritize 100,000 vaccines in the Montreal region. That's not a huge difference. And as of next week, and it was planned that way, we are going to be continuing with the distribution of vaccines in Quebec on a populational basis, as we've always done, but we really wanted to give a good strike during a short period of time with a smaller number of vaccines, which also answers another question that we had before. Why don't we extend it more in the Montérégie region? Well, if we want to make a real difference with 100,000 vaccines, we have to concentrate it. So it's only on that basis that we have done it. And of course, the vaccination is continuing everywhere in Quebec, as I said, as of next week.
Monsieur Patrick Belrose du Journal de Québec pour les questions.
Oui, bonjour à tous. Je vais faire un petit peu de pouce sur la question.
I'd like to piggyback on that question, Mr. Dubé. You said that the vaccinators, the pharmacists, the vaccinating pharmacists are going to be vaccinating, and some of them are students, some people are retired. They're going to help out, and they're wondering why they're not being vaccinated, because they are also in contact with hundreds or thousands of people and will be over the next few weeks. Yes, but once again, I'm going to repeat myself. The vaccinators are part of the healthcare workers that are prioritized in phase 1. These are groups that can receive the vaccine, and the establishments of health and social services can, according to the arrival of vaccines that they have, for example, they have to prioritize these workers. And I know that they do so. As I told you, already 200,000 healthcare workers who have been since the beginning of the vaccination. Because some people are writing, some people who, for example, medicine students, you're saying that these people will also be vaccinated? Well, if they wish to, and according to the arrival of vaccines, yes. But as I said, we had confirmations every week that vaccines were arriving for the entire month of March. And we will remember, I think Mr. Dubé said it, it's over 700,000 vaccines that we'll be receiving throughout March. And the arrival of the AstraZeneca vaccines is going to be on top of that. And Mr. Dubé, I was told that there was a generalized, like that the telephone system to take appointments was broke down yesterday. Can you tell me a little about that? Well, we're laughing, but it's not funny. We were victims of our own success, if you will. As of today, and earlier on I was looking before we came on the air, we're at over 350,000 people who have made appointments since Thursday on our website. But what you're talking about as far as the calling center, it's people who are calling. And once again, this morning at 11 o'clock, we're already over 56,000 calls on our calling center. What I'm told is that it's not a lack of workers, it's just the bandwidth. We're really, sorry, I'm not a specialist in computer things, but it really, the size of the wires or whatever, that is being challenged. And once again, Service Québec is working with our suppliers to smooth things out. But I reassure everybody, for people who are calling, if there's still a challenge, getting through the call, I'd like to remind you that there's no problems with our website. Also, I wish to remind you that, we will have vaccines for everybody. If it's not today, it'll be tomorrow. The calling center will be open 7 days a week.
De la presse canadienne.
Oui, bonjour à tous les trois.
Yes, hello, all three of you. Can you hear me? Yes. Fantastic. So yesterday, of course, you evoked that there were problems at the Olympic Stadium. A lot of people waited for a long time, elderly people, but also other people who had to wait for a good while in the same place, in the same entrance hall. What are you going to do if the elderly start not going to those vaccination centers because they don't judge that they are safe and that they're going to go more to the pharmacy? Did that go against your plan? Well, no, of course. I explained earlier on that as far as the question of pharmacists are concerned, it's complementary. If people think that they would prefer being vaccinated in a pharmacy, we're going to give them the choice, because for us, we are, indifferent. It doesn't matter to us. I would ask you to see that it was our first day, and we still succeeded in vaccinating close to 17,000 people on that first day. So yes, there were waiting times. Mr. Paré mentioned earlier on improvements, adjustments that I would say are completely normal after a first day. I gave the example of the wheelchairs. We had administrative agents who were there as a welcoming center. We added some because very often the elderly have more questions. For us, maybe it's easier to answer a questionnaire, but for people it brings other questions, so we had to take the time to answer correctly. So I think that it's quite normal, and we are going to continue adjusting ourselves. But when we're talking to pharmacists this morning, I think that it's going to be something that will be very important for us, particularly if we want to go in certain regions of the island of Montreal. So I think that all of this is going to be complementary. And that is why we have accelerated things, because we had to do it with pharmacists as of the 1st of April, and we decided to bring it ahead by 2 weeks to be able to give people a different choice. So I think that it's the patients, it's the Quebecers who will win from this. I wanted to know for the regions, the deployment, how is that going to take place? Because with the vaccination right now in certain regions, there's only one vaccination center. It's in Clermont, but it's a big region. Are all cities and villages, for example, from Charlevoix, are they all going to be able to have a pharmacy that will vaccinate, or is it going to be restrained depending on the regions? No, the idea is for all pharmacies who wish to do vaccination in their area that it will be done. As Mr. Dubé was mentioning earlier on, our community pharmacies are areas of proximity for our villages and our neighborhoods, and that is why for us it's important that the deployment starts as quickly as possible. And once again, congratulations to our partners who raised their hands and who are working with us in order to start the vaccination in their communities. And maybe just to give two statistics to better answer your questions. First, I said 350 pharmacists on the island of Montreal, and there's 1,400 in Quebec. So there's at least one in the Malbaie region, I'm sure of it. And secondly, we also expect, if everything goes well, that out of the 12 million doses that we have to give to vaccinate, the 2 doses during the summer to most Quebecers, the pharmacists are going to do at least 2 million doses. So 2 million out of 12 million is a big contribution. So I think that we're happy to have them with us, and we're happy that they'd be able to start earlier. So it gives you an idea of the importance of that partnership. We will now go to Marie-Michelle Sioui.
Bonjour.
Bonjour.
Ma question pour
My question,
qui voudra bien répondre. Quel est votre échantillon
what is your
oui ou non bel et
the
bien
date to know
des
whether
cas de
there's been
variants dans
cases
les
of
écoles qui ont
variants
été
in
fermées?
schools that were closed?
Je sais pas si je peux
I don't know if I could give that to Horacio to answer. It has to be understood. Thank you for the question, because I want to take advantage to explain to people what that means, the variants. And a little bit like the minister was saying earlier on, we are right now really in a period where things are calm on the plateau, not too many waves, things aren't going down, but below that there's sharks, and those sharks are the variants. These are strains that are a lot more transmissible, and there's a lot more in the Montreal region than there are in the rest of Quebec. And those variants are the ones that are making us prudent, because if we let them explode, they are going to take over, and especially in regions like Montreal, we're going to see a very rapid increase in the number of cases, like what happened in Great Britain and elsewhere. So we cannot stop with the measures that we've recommended and set up. Whether there's been cases of variants in school settings, yes, there have been. However, I just want you to know that right now, because of those variants, we have a very aggressive approach as far as the interventions are concerned. Whether it be a variant or not, right now we consider that it is a variant, in as far as we isolate people more, we test more quickly, we ask contacts of cases to remain at home, and contacts of contacts before getting the results, and we ask them to get isolated, and we have tests to detect, to deliver, and to see whether it's a new variant. So right now we're taking the hypothesis in Quebec that these are all variants in order to prevent the growth. If we are able to maintain that rhythm and to keep growth and to get to vaccination to protect everyone, and I would like to repeat here something that is very important. I'm sorry, to take the time, but I have messages to give. It's not because you are vaccinated that you're protected right away. It takes a minimum of 3 weeks. And even if you are protected, you can still transmit the virus to somebody else without being ill yourself. And you are protected yourself, but you get infected. You're not going to get sick, but you can transmit it. That's why it's still important to keep the distancing, to keep washing your hands, and to keep wearing the mask. It's important to mention it because we're feeling right away in people a certain impression of being protected as of the day following vaccination. And what I want to say is that that's not the case. So there's been variants up to date. We're at about 137 cases that have been sequenced, the vast majority being the British source, the vast majority being concentrated in the metropolitan area. And right now, we are at 1,000 some cases that are being crippled and who are suspect. So the variant is there, and the variant is under the water, and it's just waiting for those conditions to repeat itself and replicate itself in people. That is why it's so important for us to be prudent right now, up until we have a greater coverage with vaccinated people. So we have to remain very, very prudent right now.
Merci. En tenant compte de ce que vous venez de dire, je comprends.
We realize what you just said, and I understand that you don't want to reveal, that you don't want to stop people being careful. But I'm wondering, with the timeline, is it good to wait 10 or 14 days from a public health point of view after spring break before moving anything? Can we take it for granted that nothing will change before, say, the 22nd of March? Until you are able to measure the effects of the March break? Well, I'm sorry, I'm not going to be answering your question because those discussions are not yet over, and each 24 hours of data can help us make a decision. That could be different. It's not because we don't want it, but I haven't given a written notice either to the government or written advice. We've given ourselves a little bit of time to take as fair a decision as possible. We will now go to English questions.
Thank you. Cindy Sherwin from CTV. I have a similar question for Dr. Arruda from my colleague in French about AstraZeneca. The federal government said today they're expecting hundreds of thousands of doses. The NACI has recommended that 65 plus not receive it. Other provinces are handling it in all different ways. What is Quebec's plan? Will you set it aside for younger people or proceed to give it to seniors as well?
We are waiting for our Committee of Immunization of Quebec from their advice. As you are telling, it has been authorized even for after 65 by Santé Canada. Some other organizations are keeping it under 65, but we will wait from the advice of our committee. I think it's good news. It's a good vaccine. I think it could help protect a lot of people before, I would say, a third wave or even soon. So I think we're going to use all doses available for Quebec in the right situation for the right person. And it's an easier vaccine to give in different contexts, which is very important because we have been a lot limited by the effect of the frozen vaccines from Moderna and Pfizer.
Minister Dubé, if I may, could you provide more details in English about the pharmacist plan, the numbers, how many in Montreal, how many overall, will it be expanded, and will they indeed be able to store properly the vaccines that they receive, et cetera?
Well, I don't want to keep the good news for me because Danielle has been negotiating that with a team, but the good news is that we have made this arrangement with the Association of Owners of Pharmacy, as we have in Quebec, more than 1,400 of them. We have agreed that instead of starting as of April 1st, when we were supposed to, we accelerate the process to be able to take some appointment starting March 15. So we're just asking people to wait for March 15 to phone at their pharmacy because a lot of people were phoning since yesterday. The good news also is that once we have put once we have the vaccine in place, Moderna being one of them that we are supposed to receive in that week of March 15, we will enlarge the number of pharmacists across Quebec to reach that 1,400. Our global objective over the next few months is to use the pharmacists to provide roughly 2 million doses over the next 4 or 5 months. So it's a big contribution that we get from the pharmacists.
And just to confirm, that's 350 right now.
On the island, yeah, we will start, I think, give us a few days, maybe on March 15 we'll have 100 and the following day because they need to be on the same arrangement of Click Santé to make sure that the appointments all come coordinated together. But in that week, I think we'll have a good start in Montreal. Have I forgot? C'est beau?
No, I think you said all the right information. And you were right also about March 15, because the unknown, even now, it could be, we could receive the vaccine maybe on Monday, Tuesday, or Wednesday. So this is why we're talking about the week of 15 of March.
Merci, Daniel.
Et maintenant, je rappelle que les journalistes doivent lever leur main via la...
I would like to remind journalists that they have to raise their hand to ask their question.
Un autre journaliste sur place, donc je vous invite à préciser votre nom, votre média, question sous question, s'il vous plaît.
Merci. Hi, my name is Gloria Enriquez with Global News. People 70 and older in places like the West Island can't get a COVID vaccination appointment because all the slots are filled until at least the end of March. Has the health ministry underestimated the number of people in this category who would need the vaccination?
Daniel, veux-tu y aller?
Well, what you should know, it's we will be able to open some more space or some more sorry about that. Some more rendezvous, I should say, for the population. Why we don't open everything on the same day? We want to make sure that we have at least 75 or 80% of all our. Can you help me for that word? Don't ask me why. For the plage de rendezvous. Sorry about that. So you don't be surprised that we will open some more plage de rendezvous tomorrow.
Can I just add something? Because the challenge that Daniel and his team have is we took 350,000 appointments over the last 3 days, and we only receive 100,000 vaccines per week. So yesterday, when we were at first day, 17,000 vaccine. If you do that 7 days, I mean, those 100,000, they're gone. So we want to make sure that people understand that when we get the vaccine, we put the appointments in the coming 2 or 3 weeks, but we're limited in the number of vaccine. If we get the Moderna in the week of March 15, then we can go up to that 700,000 for the month. So we'll be able to increase the number of appointments. But this is the challenge. He needs more vaccine, but I think he's finding the best equilibrium right now with the limited number of vaccine that we have.
Perfect, thank you. And my second question is, what is your reaction to the online petitions demanding that mandatory mask wearing for elementary schools be withdrawn? And why is it still necessary for masks to be worn in school if COVID cases are going down and more vaccinations are rolling it out?
Well, I'll let Dr. Arruda to.
Yes, I'm very happy you asked me the question because that's something I want to say to the parents because there is some anxiety related to that. And it's because of the variants, really. Even a lot of provinces are still using masks, but specifically in Quebec, we thought it would be for elderly people, elderly students, a good thing, and it's why we did introduce that. But actually, with the new variants, I would tell you, and that the kids can transmit that variant more easily. I think it's a way of protecting themselves and also protecting more, I would say, their families. So I think the kids can adapt to that, and the government is going to give not couvre-visage, but real procedural masks, which are lighter, easier to do. So I think it's a very important measure that we are adding in the context of the variants, which can transmit a lot in school, give outbreaks, and also come to home, and we want to protect the families.
Dr. Arruda, j'ai quelques médias en français qui aimeraient...
Dr. Arruda, I have a few media in French who would like for you to repeat that in French as well, if you could. Yes, I thank you for the question because we hear a lot of parents who are worried about the question that we're forcing their children to wear a surgical mask as of the 8th of March in the metropolitan area. And when they are available elsewhere in Quebec, and they will be, in the meantime, the face covering. What's changing? What you have to know is that in many countries, and even in Canada, it is the mask that has been recommended as of the beginning of the year at different levels. But in Quebec, we've always requested it for older people, taking into account our epidemiology. But right now, with the arrival of the variants, which are truly very transmissible and for which children can become what we call a vector of transmission at home or elsewhere with their parents, we believe that this is a measure that is necessary right now. These are masks that are going to be surgical masks, or a lot lighter, pediatric masks, so for younger children, and we know that children can adapt themselves to that reality. So I want to reassure parents, it is to protect the children and as well to decrease the potential risk because of the variant, and that is truly the thing that is changing the equation right now. Thank you. We will now go to Zoom questions in English.
Oui, bonjour, thank you. You can hear me okay?
Yes.
There was an article in the Gazette today talking about how the Immunization Committee is reviewing potentially its priority list for younger people with chronic disease or illness to be moved up the priority list to get the vaccine. Where are we on that?
From my knowledge, I would say that we have a sequence which is related to the risk of getting to the hospital and to dying from the disease. And I think there could be some reflections on which, inside of a group, which one can be. But at the same time, as we will have more and more vaccine, those numbers 6, 7, 8, 9 can be almost at the same time. So I think there is probably discussion, but we have not officially changed any priority groups for the moment, unless Daniel is more informed than I am, but I don't think so.
No, there is nothing new on that. But if, for a reason or another, the Quebec Immunization Committee decided to change a group, we will adapt to that.
Et maintenant, sous question?
Yeah, my other question is, what have you learned? I mean, we're only a couple of days into our first big mass vaccination campaign here in Quebec. What lessons have you learned, and what corrections could you bring?
Well, the first lesson, it's vaccination is popular, which is good news, you know. I mean, we're really pleased about that the population accept to be vaccinated. They're going on our website, taking their appointments. And but what we learned from our first day yesterday in Montreal, we have to adapt a little bit more about elderly person, such as more wheelchair, more chairs around, and we also add new employees at the accueil when we meet the elderly person at first, when we ask questions, because they're asking more questions. So we had staff in order to be more efficient, and actually today we're doing better.
Et maintenant, pour une dernier journaliste en anglais, donc Morgan Lowry, Canadian Press.
Hello, good afternoon. Can you hear me?
Yes, very well.
Okay, perfect. First of all, I was wondering if you have an idea yet of what this whole vaccination campaign is going to cost.
We're still adding. I think, to tell you the truth, the more we add, I think this is going to be very expensive. But is there a price for saving life? I think that's the answer that I will give you today is no. We are doing everything. I just give you some example is if we can have additional vaccine, if we can secure additional vaccinators to make sure we accomplish our goal to vaccinate Quebecers faster. If it takes more people, we'll do it, because I mean this is a question of life and death. So to me, we will, when we have a better idea on how long this will take, because that's a big issue. If we are able to vaccinate every Quebecers within 8 months, that's something. If we can do it in 6 months, but I mean, there is also a difference in the cost. So right now, I think the biggest question is still the supply, how fast we will get it. But so far, we have been able to adapt, but the cost will come later, but this is not the big issue right now.
Okay, and just as a follow-up follow-up maybe to Dr. Arruda, we've seen hospitalizations go up for the last 3 days. It's not by a lot, even as cases are lower. I was wondering if you have any idea of what's behind that. Is this because of the variants? Is this something we should start to be worried about?
In fact, it's what I was telling, that we must be very careful. That could be variant. That could be a slower slope going up. It could be a small variation that will go down. But we are looking at this data every day, even I would say 2-3 times a day, because that could be, I could tell you after the good time, a storm coming. So it's why we want to be very prudent, and we are making changes progressively, because we don't want to be back to what we had already with a stressful hospital system and having the lestage and all those issues related to healthcare.
Alors, c'est ce qui met fin au point de presse.
This puts an end to today's press conference. I wish to thank everyone for having been present. Thank you very much.